All right. Good morning.
Beth.
My name is Sarah Gelser. I am the state representative from Corvallis and Philomath, which is House District 16. Today, we are here to announce the Oregon Women's Health and Wellness Alliance's legislative agenda for 2013. Here with me is Senator Elizabeth Steiner Hayward, and we are honored to be joined by other members of the Alliance and some special guests that we will introduce as we go along this morning. Senator Steiner Hayward and I are proud to be the co-chairs of the Oregon Women's Health and Wellness Alliance this year. The Oregon Women's Health and Wellness Alliance is a bipartisan group of legislators, healthcare personnel, state and local agency staff, and citizen advocates dedicated to promoting the health, safety, and economic well-being of women. The group was started in 1993, making this the 20th anniversary of our organization. It is amazing to think about how much has changed for women in Oregon just over the last 20 years, thanks to many of the people in this room and others who have been involved with the Alliance and its efforts over the last 20 years. There are many things we now take for granted that would not have been realized without their hard work, including contraceptive equity, full coverage of cervical and breast cancer screenings, and protection for domestic violence victims and survivors, and for breastfeeding mothers. I am proud to be the co-chair of the Oregon Women's Health and Wellness Alliance along with Senator Steiner Hayward, and to continue to work alongside its dedicated members to ensure Oregon is a place where women can live safe, healthy, and productive lives. We have been working for the past year to put together a slate of legislation that we are here to present this morning. We have 12 items, and we could have had many more. There is so much work to do. But we believe that these 12 concepts most closely align with the goals of the Alliance and represent many of the most pressing issues facing women in Oregon today. I'd like to talk about several of the bills now, and Senator Steiner Hayward will speak about several others. The Alliance has always been a strong advocate for victims of sexual assault and domestic violence survivors. This session is no different. We are supporting 3 important bills in this area. First, we are supporting a bill that creates a sexual assault protective order to offer protection to those who are subjected to sexual abuse. Oregon currently has strong tools to provide civil protection orders for victims of domestic violence and stalking. But some victims of domestic violence and stalking are left without similar remedy. Those are the individuals who are not involved in an intimate relationship with their attacker. This has to change, and that is what the Sexual Assault Protective Order bill will do. I want to thank Lieutenant Dave Okada with the Salem Police Department for being here with us today. He has specific experience dealing with domestic violence and sexual assault victims, and will be here to answer any questions you might have about the need to create a sexual assault protection order for Oregon survivors of sexual assault. Second, we are supportive of a bill that would extend workplace protections to victims of domestic or sexual assault to new and part-time employees, and to ensure that all employers are aware of these protections and have those rights appropriately posted in the workplace. Third, we are supporting an increase in funding for the Oregon Domestic and Sexual Violence Services Fund, which provides emergency shelter, expert safety planning, counseling, and other support services to victims fleeing sexual and domestic violence. Next, in the area of economic, equity, and employment issues, we are supporting the Domestic Workers Protection Act, which will extend workplace protections to individuals who work in others' homes. Domestic workers, people like housekeepers and nannies, and in-home caregivers for seniors and the disabled, play an increasingly important role in our communities, but they are not currently protected by basic workers' rights and are unable to ask for fair working conditions. This bill will help to change that. Now I'd like to turn it over to Senator Steiner Hayward to talk about the rest of the bills on our priority list. Senator Steiner Hayward.
Thank you so much, Representative Gelser. I'm Elizabeth Steiner Hayward, State Senator from District 17, Northwest Portland, unincorporated Washington County, parts of Beaverton. And I'm very proud to be here this morning as the Senate co-chair of the Oregon Women's Health and Wellness Alliance. Representative Gelser has told you about several of the bills, and I will wrap up the group. Next, in the area of economic equity and employment issues, we are supporting earned sick leave, as we believe all employees have the right to earn sick days to be used to recover from illness or take care of sick children or family members without the threat of losing wages or employment. This is a public health issue as well as an employment equity issue. We're also supporting a bill to create a separate license for practitioners of natural hair care, which is a common practice in African immigrant and African American communities. This would help remove barriers to natural hair care business and create economic opportunities in these communities. In addition, we are supporting efforts to build on the governor's recommended budget to restore the lifetime limit for the Temporary Assistance for Needy Families, or TANF programs, to 60 months, and to increase the employment-related daycare program to 10,000 slots to really help get people back to work. In the area of women's health, we are supporting 4 important bills. First, we are supporting a bill that will ensure pregnant women with diabetes are able to get the health care they need to manage their disease. With this bill, we hope we can prevent the devastating health conditions that can affect both a woman and her baby if she does not control her blood sugar during pregnancy. Second, we are supporting an increase in the number of slots available for screening through the Oregon Breast and Cervical Cancer Program, which provides screening for these really dangerous and scary diseases for women at less than 250% of the poverty level. Third, we're supporting a budget note to the Oregon Health Authority to make prenatal care available to all low-income women starting in the first trimester. Early prenatal care is critical for healthy babies. Finally, we are supporting a bill that would increase education of women whose mammograms demonstrate dense breast tissue, which both increases risk of breast cancer and makes it more likely that a mammogram will miss cancer. Laura Caldwell, an incredibly strong woman from Eugene, will now share her powerful story, which demonstrates the importance of this bill. Laura?
Thank you. My name is Laura Caldwell, and I live in Eugene, and I'm honored to be able to share my story in support of Senate Bill 420. I am the mother of 3 children, and I have been happily married for 26 years. In August of 2011, I had my annual mammogram, as I had had for the previous 6 years. My mammogram came back clear and fine, and with no history of breast cancer in my family, I was never worried about taking this test. A month later, after several days of pain underneath my arm, I went to see my doctor, and noting that I had a clear mammogram, she put me on a course of antibiotics and said, "Please come back if it's not better." 10 days later, and still referring to my clear mammogram, she sent me for an ultrasound just to be safe. My ultrasound revealed a lump, and a biopsy confirmed invasive ductal carcinoma that had spread to my lymph nodes. When the diagnosing doctor called me to tell me the news, now just 8 weeks from my normal mammogram, I asked him why the mammogram hadn't caught the tumor. He said it was because I had what was called dense breast tissue, and that tumors don't show up as easily on mammograms of women with dense breast tissue. In fact, he said he was looking again at my 8-week-old mammogram, and he still could not see the tumor on the scan, even though pathology confirmed the cancer diagnosis. When I questioned him further, I said, "No one has ever told me I have dense breast tissue." He replied, and I will quote him, "We don't usually tell women that information." I would find out later that my tumor was 2 years old by the time we discovered it. It could have gone undetected even longer had I not developed symptoms, and in essence, I had probably had 2 to 3 normal mammograms, all while living with the growing cancer. Despite the fact that 40% of women have dense breast tissue, and women that have it are 4 to 6 times more likely to develop breast cancer, fewer than 10% are told by their physicians. And as you can see from my own experience, I only found out about my dense tissue and then ultimately my cancer because of that supplemental screening. Having dense breast tissue is a risk factor. There's no history of breast cancer in my family, but breast density is a more significant risk factor for developing breast cancer than having a first-degree relative with it. My work puts me in front of hundreds of women every year. I have discovered as I have shared my story with them that the majority of women have never heard of dense breast tissue, let alone if they have it or that it's a risk factor. We all know that early detection is the best possible way to treat breast cancer. I cannot help but think that had I known about my tissue density, I could have, early detection would have prevented the cancer from moving to my lymph section. My cancer, as with all cancers, show up as white on a mammogram. Unfortunately, dense breast tissue also shows up as white on the scan, hiding many cancers from being seen in those of us with dense tissue. Women should be receiving this information in their doctor's offices and not after they've already developed cancer. I've also encountered women that have discovered that they have dense breast tissue, many with a history of breast cancer in their family. And they have had to fight with their doctors and insurance companies to get the necessary screenings to find out if cancer is present. I'm thankful that Senate Bill 420 would guarantee women the ability to get these additional screenings. My cancer diagnosis classified my cancer at stage 3. It was not detected early because of the failure of mammography technology to detect cancer in my dense tissue. I'm encouraged that this bill would notify more women earlier and provide additional screens to those that need it. Oregon has one of the highest rates of breast cancer in the country, although it has one of the lowest death rates. This could shift dramatically in either direction, depending upon the outcome of this bill. In 2012, I completed 4 months of chemotherapy, a bilateral mastectomy with lymphdectomy, and 7 weeks of daily radiation. I went into remission last March. However, this last Friday, the doctors have discovered another tumor, this time on my brain. They do believe that it is most likely the breast cancer that has moved through my lymph system into my brain. I will have it removed in a week. There are only 5 states in our country that require doctors to tell women about their breast density, and only 2 of them that include the insurance coverage portion. I'm optimistic that Oregon will be the 6th. It is an important bill to me and to my daughter, who will inherit my dense breast tissue, someday to my grandchildren, and I believe it is important for our state as a whole. Thank you.
Thank you so much, Laura. I really appreciate you sharing your story. This is why we do what we do. This is why the Women's Health and Wellness Alliance is so critical for the health of Oregon women. So in closing, thank you all for joining us today. We appreciate the opportunity to communicate what we believe are important steps toward providing Oregon women a happy, healthy, and economically productive future, which is what they all deserve. We appreciate your time and are happy to answer any questions. Chris?
Are you any closer on getting the diabetic bill along?
Yes, we're a lot closer. Actually, Representative Gelser and I have both been in conversations that have. You want to talk about yours first?
Sure. I just spoke with ODS this morning, who had kind of generated that very large fiscal that came up in the Healthcare Committee. They have some recommended amendments that would remove the fiscal, and they will not oppose the bill if we adopt those amendments.
And I had similar conversations with another insurance company yesterday to make it clear that we did not intend for this to take away their ability to recommend certain medications or certain kinds of glucose monitoring devices that they know are more cost effective. We just wanted to make sure that women had access to those without cost during their pregnancy. So they're going to make some recommendations about how to tweak the language a little bit too, and that will help remove some of their objections as well. So we think that we're making really good progress on that.
With the state's healthcare overhaul coming underway in CCOs, is there anything in the current system that you would like to see improved that could help women?
You know, one of the budget notes that we're working on right now is to expand access to prenatal care and ensure that all women get prenatal care early in their pregnancy. And the CCOs will clearly play an important role in that, and we want to help facilitate their doing that. So whether there are specifics in the CCOs, I think it's a little early to tell. We heard yesterday in the Senate Health and Human Services Committee about a lot of the metrics that are being used to hold CCOs accountable for quality, and many of those involve maternal and child health, which I'm pleased about. There are other ones that will be part of the system that will talk about ensuring that women don't have unplanned pregnancies, that I think will also be important. So far, so good, but we just want to make sure we continue in the right direction. Any other questions? Thank you all so much for attending. We really appreciate it, and thank you to all of the people you see behind us are our partners. In particular, I'd like to acknowledge Senator Rosenbaum, who was the co-chair on the Senate side of OWHWA for many years and has been involved with it throughout her tenure in the legislature. And I was really honored that she asked me to step in now that she has duties as the majority leader. And it's a real pleasure to follow in your footsteps on this. We have great partners in a whole range of areas, and it's really great to see so many of you in the room and standing here with us today. Thank you for your time, and thanks for attending.
Thank you.